outside a hospital and I can't get a single appointment with a doctor. I've been here for 3 years and I want you to guess why. Is it because A, I look homeless? B, I'm secretly running a black market making appointments and selling them on Craigslist? Or C, there's a physician shortage causing insane wait times? Don't take forever. Why don't you guess?
What the fuck? You can't film here. I told you this. Get the hell out of here.
If you guessed physician shortage, you're unfortunately right. If you guessed A or B, don't worry, you're not stupid. I'm about to break it down. My name's Akash, I'm a broke pre-med student, and this is Big Brain Time Medical Math. Physician shortage. It's a term thrown around a lot.
Shortage of physicians.
Shortage of primary care physicians.
Short about 3,000 doctors.
But what does it even mean? It's honestly pretty self-explanatory.
Dude, I'm not short. I'm 5'10".
Hey, shut up. It means we don't have enough physicians to meet the public's medical needs, hence the long wait times and not being able to see a physician when you need to. In the US specifically, we suffer shortages in rural areas and marginalized communities. In fact, in a recent study, the United States is projected to have a shortage of up to 139,000 physicians by 2033. Now, there's a lot of reasons this can happen. Healthcare being a system that prioritizes profits over people, poor American standards of health that are taken advantage of by hospitals, and me making my doctor sign exclusivity contracts. Today, though, we're gonna focus on one reason in particular: medical residents. Now, just like you're asking yourself every tax season, what counts as a resident? In the medical context, they're medical school graduates doing their postgraduate training under attending physicians at hospitals. In Pokemon terms, if undergrad is your egg, medical students are your Charmanders, residents are your Charmeleons, and attendings, well, they're your big boy Charizards. And to level them up and evolve, it costs $500,000. Now, to get into why these half-baked Charmeleons are a fuel for the physician shortage, we need to talk about the history of how they're underpaid and overworked. It all started before 1965. Residents went through their expensive training programs without getting paid. Well, they got a small stipend, but it was basically as bad as your dad handing you a $20 bill for allowance at the beginning of every month and then making you pay his mortgage. You could basically only be a doctor if you came from a rich family.
I want a medical degree.
All right, yeah.
Well, then on top of salaries, you also have to pay for the training program, which was funded by hospitals. Then came Medicare, the Ant-Man quantum-mania of government programs. Very well-intentioned, but very shitty execution. This came into play in 1965 and started paying for resident training, so hospitals focused on paying higher salaries. Now, over time, inflation occurs, so prices pulled a bread in the oven move and started rising. So, resident training program costs and resident salaries also rose, so much so that the government in 1997 was like, WTF, no, and they put a cap on resident education funds. Which, if we think about it, just makes sense, right? Why spend money on training doctors when we can just bomb the Middle East? Anyway, the government looked at hospitals and were like, all right, now you guys pay more of their salaries, and hospitals were like, okay. What? You're just gonna take that? I mean, the alternative is spending way more money to hire big boy attending physicians. Why would we do that when we can spend less and get trainees?
Just like I planned.
So with that thought process, hospitals followed the cheapest route and funded more of resident salaries, while government spending in healthcare had a massive cut. But now, because of that, we get into the problem of residents being overworked. Residents have MDs or DOs, so while they are physicians, they're not fully trained, licensed physicians. And because of that, things can get potentially messed up, such as the death of teenager Libby Zion in 1984. Libby died because she was given 2 medications at the exact same time that are not supposed to be mixed. What resulted from this was a serious and actionable movement towards looking into residents from being overworked. At this point in time, residents would frequently be working 100 hours a week in recurring and consecutive 24-hour shifts. That's like clocking in at 8 a.m. on a Monday and clocking out at 2 p.m. on a Tuesday. Studies show that residents working like this can make anywhere from 36 to 700% more serious medical mistakes. What resulted from this intense focus was a series of changes in 2003 where the government declared that residents needed to be capped at 80-hour work weeks for all specialties. Residents would also need to get a day off for every 7 days worked, and their shifts were capped at 30 hours. So now, residents aren't allowed to work as much as before, so hospitals had to absorb costs once again to get other staff to work when residents couldn't. Let's fast forward to now. Things have gotten so much better for residents. They're treated with respect, all the attending physicians are super nice to them, and they ride unicorns to work. Alright, yeah, I'm messing with you. Residents currently work 80 hours per week and they're paid $10 to $12 an hour. That means like Ranjiv from Baskin Robbins is making more than someone that's been through 4 years of medical school. Like, what kind of bullshit is this? Ranjiv isn't even a good employee. Every time I order mint, he gives me pistachio. Ranjiv. Shift hours can be abused to the point where some specialties make residents still work more than 80 hours a week. And that is our first reason for our physician shortage. Residents are dropping out of residency, and a large number of them are citing being overworked as their main reason for dropping out. Like in 2022, there were 1,640 psychiatry residents and 7% left. Now that may seem small, but that's 114 people dropping a deuce and peacing out. With the physician shortage, we can't have people quitting like that. On top of that, because of limited Medicare funding, there are already a limited number of residency spots. This means that not all medical students who graduate can become residents. Now this brings us to our second problem, residency spots, especially in primary care. They go unfilled. This is exactly what happened with emergency medicine this past year. They had 550 open spots. This ends up happening a lot due to hospital underfunding and budget cuts, especially with primary care spots, which in turn limits how many of them can become attendings, which then fuels the physician shortage. So in summary, we have a two-sided problem for this physician shortage. One, residents dropping out because of overwork, and two, medical students not selecting to go into primary care because the low salary and high chance of burnout just don't make it a good deal. Don't worry though, no freaking out aloud. Things are slowly changing. And who am I kidding? It's the US government. So they're taking longer than it's taking The Daily Show to decide on a new host. Guys, I love the guest hosts, but I need a permanent mom or dad to tell me what to think about NFTs and Pete Buttigieg. I don't have my own opinions. More recently, a COVID relief bill passed in 2020, creating 1,000 residency spots over 5 years. It mainly focuses on providing extra funding for residents in rural areas. Another solution, how about spending more money to increase resident salaries? Okay, I'm half joking. I realize I'm asking for the world and that this is the US, where things are slower than Mitch McConnell trying to say the word sloth. I get that by saying that we have to pay people more, it doesn't just happen. There's no genie. There's totally a genie. But whether you watch this video and remember a lot or a little, this conversation will get started. For more solutions, we now go to our senior correspondent on the field, Eliza Gandhi.
Hey there, Akash. Happy to be here.
Thank you so much for joining me. Now, Eliza, this physician shortage is a very serious issue. What sort of things can patients and us normal folk do to help out?
Wow, Akash, that's not the problem at all.
I'm sorry? What do you mean? This entire episode is about the physician shortage in America.
Akash, listen. We don't have a physician shortage. We have a patient shortage.
I'm sorry, what?
Think about it. We have a perfectly good amount of doctors. We just have way too many patients.
Eliza, I don't think...
Yes, that's the case. We have 7 doctors in the hospital by my house. That would be a perfectly good amount of doctors, but the hospital is always super busy because the Johnson kids keep running over each other with motorbikes. Beep, beep.
White people. Okay, Eliza, that's what happens. People get hurt, and the medical community steps in to take care of everyone.
Well, then people should just stop getting hurt. That would do wonders for the physician shortage. Primary care residents wouldn't drop out from getting burnt out from these stupid injuries.
Okay, point of agreement. Getting hurt constantly does contribute to strain on the healthcare system. But how do you propose that people go about staying more safe?
It's obvious. Just don't go to the hospital. Duh. I haven't been to the hospital in years, even when I broke my arm running Jerry Johnson over in a motorbike.
Okay, a lot to unpack there, but you didn't go to a hospital? You really should have seen a doctor in that case.
It's fine. Look, all healed.
No, don't show me. Please don't show me. Please.
Akash, the point is, everyone wants to buy the new limited edition Mickey Sniffles Gucci bag, but it sells out. No one attacks Gucci and Mickey the man Sniffles for not making enough bags. It's the customer's fault for not camping out for 4 days. If there aren't enough doctors, then some patients just gotta take the L.
Take an L. Eliza, these are people's lives we're talking about. We need to be able to supply care to everyone. You know, what if we advocated for more doctors in politics so that they can introduce bills that actually make a difference in healthcare? Or how about advocating for treating doctors with respect so that positive patient interactions help residents want to stay in primary care? Or even pushing for more hospitals to take a bit of a loss to properly care for people instead of chasing profits.
I never thought of it like that. Those are pretty good solution ideas, Ka.
Say thank you. I knew there was a logical...
Or, hear me out here. We could introduce a virus into the patient population. That way, there wouldn't be as many patients. We could call it...
Okay, Eliza, that was very
COVID-19.
insightful. Remind me not to call you if I ever get sick. That's Eliza Gandhi, everybody. With that, thanks for watching this episode of Big Brain Time. Please consider subscribing. I'll see you next time.